Hi there, welcome in. I'm B. I'll be taking care of all your teeth needs today. So, on my chart, I've seen that you're interested in a cleaning, and we specialize in no judgment, gentle, high risk dentistry here. So, you're in very good hands. And then I see as well that you're interested in learning a little bit more about the bespoke custom dentistry we do. Of course. Let's start with the cleaning, and I think you might be due for X-rays. Okay. Can you confirm your date of birth for me? Okay. And your name? Okay. You are who you say you are. That's perfect. So, let's get those X-rays out of the way. I know they're not the most fun sometimes. Okay. Have you put this on your mouth here? And then bite down. Okay. Perfect. I'm gonna step out of the room for a moment. You'll hear a beep, and I'll be right back. Okay, open up for me. Perfect. Let's do the other side. Here. Bite down. Very good. Okay. Okay. I'll take those. You can release. Okay. That's all there is to that. So now we'll do your cleaning, and I'll just assess before I go in, okay? Now, this is a no judgment zone, okay? So I'm going to ask you a question. There's absolutely, whatever your answer is perfectly fine. Do you know how long it's been since you've had a dental exam? Okay. And do you remember where that was? Okay. Were there any problems at that time? Okay. Do you mind if I touch your face? Okay. I'm just feeling around. Feeling your chin, your neck. For any lumps or bumps. Is there any pain? Okay. Open your mouth for me and stick your tongue out. Okay. And say, ah. Okay. So you didn't have any issues. Have you been having any pain recently? Anything to report? Okay. And that's on the left side, you said? It's over here. Okay. Mind if I take a look again? Okay, open up for me. Okay. Now does it hurt when I push here? And what about here? Okay. Keep letting me know how much pain you're in. If it goes above a 3, where you're starting to wince or it's really uncomfortable, we'll stop and take a better look, okay? Based on where you're telling me it's located like way back here, I'm a little suspicious of maybe a wisdom tooth issue. Have you had your wisdom teeth out? Okay. And when did you have those out? Okay. So not that long ago, really. Okay. I'm gonna feel again. How many wisdom teeth did you have? Okay. Okay. And that went okay, that whole procedure? Okay, okay. That sounds pretty normal. Okay. I think we'll be able to figure out some more things when I get in there, of course. Okay. Oh. Thank you. Is this your retainer? Have you had braces? Oh, I'm sorry, it's your night guard. Good. I'm glad you have a night guard. Do you want me to clean it? Of course, yeah, of course. I'll just clean that here. I'm going to put it on this tray. And I'll put some fluid on it while we're here. And that should be clean by the time we're done, okay? Off you go. Perfect. I'm glad you brought that in. We always offer to clean them, but people forget to bring them. Okay. This is going to go on your chest here. Just a little bit for you, okay? Perfect. Have you open up for me? Your lips look a little dry, so let me see. I have a little bit of this. It's just a little bit of excuse me. It's just a little bit of hydrating serum. I can put it on your lips if that's okay. I don't want them to crack. Okay. Hopefully that feels a little bit better. Are you feeling comfortable? Okay. So I forgot to mention this, but if at any time you're feeling pain, discomfort, or just need a little break, I know everybody's different with their tooth sensitivity. If you're a person that gets sensitive, no judgment at all. All I want you to do is bring your hands up by your ears, okay? That'll tell me to back off. Give you some time, some space, and we can talk, okay? Yeah, so just remember, you can cover the ears just like this. Cover the ears if you need a break, okay? Okay. So open up for me. I'm just going to take a peek here. And this is the painful spot here. I'm just going to tap a little further back, so maybe here or here. Okay, so that's almost on the fleshy part of your mouth there. I'm going to try the other side, okay? How does this feel? Seems okay? Okay. I'm just going to start cleaning. I do see a little bit of buildup here, but nothing we can't take care of, okay? Mind turning your head a little bit towards me? Okay, thank you. Do you floss? Sometimes? Yeah, it's a good habit to get into for sure. But it's no problem. No problem at all. So far, so good. Are you feeling any pain? You doing okay? So, you know how egg prices have gone up? Yeah. I had this wise idea to get myself a little flock of chickens. And I live in town, and I don't know what I'm doing. But I decided that would be a good idea for me to get some chickens and take care of them and have a little hen house. So now I like to say I live in a sorority, me and my chickens, because I don't have any roosters or anything. But you know what's nice is I've actually made a little cash, believe it or not. Yeah. I've made a little bit of cash because I'm the chicken lady. I'm the egg lady on the block. Yeah. Just have a little bit extra here. And don't tell my HOA because I don't think that they actually allow chickens. Not that you would tell, but my neighbors aren't telling anybody. They're happy about it. Yeah. Yeah, I get their eggs nice and cheap. I get my eggs nice and cheap. And I try to take good care of those cows. Yeah, I try to take good care of them. Okay, I'm gonna have you turn your head a little bit towards me here. Yeah. Yeah, I mean, I haven't named them, right, or anything. I don't think I will, but I can tell them apart, like their colors and stuff. So I got a couple of them from a friend, actually. I mean, she's in touch with this farm, and she's got all this organic stuff that she buys from the farm, and then the farm wanted to sell these chickens for whatever reason. I don't know why they'd want to get rid of them, but they did, and they had 2 available, and I just felt like that's not enough. They're gonna be so lonely. Look, I don't even know if chickens get lonely, but I went to the like Fleet Farm store, whatever. I forget what it's called. You know what I'm talking about, like Tractor Supply, something. They had chicks that you can buy, so I got a couple chicks, and now they're not laying yet. They're not old enough. They're still kind of small, but because I got them so young and I sort of handled them often, they are very friendly. I mean, they sorry, you just have a little bit extra here. There we go. How you doing? You doing okay? Okay. And you don't mind my talking? Okay, good. I'm glad it's a good distraction for you. Okay. So, what was I saying? But the older hens, they don't, I don't think that it's that they don't like people, like, I mean, they would like to be fed. If I have food, they'll come, but they're not as trusting, I guess, is how I would put it. They're not as trusting of people. They're kind of always watching around, like looking for things, looking for danger. So, well, anyway, I love them. That's all. That's the moral of this story is, if you're thinking about getting some hens, get some hens. You'll get free eggs. You'll have lovely little outdoor companions. And if the HOA tells me I can't have them, well, I'm moving. Yep. I don't think they would, though. I don't think it really matters. But don't tell them. Do you need a little break? Of course, of course. No problem at all. How's that retainer looking? Night guard. Okay. Looking pretty good. Well, while we wait here for a second to just kind of rest, give our mouth a break, do you need water? Of course, here. Here's a little cup for you. And the sink is just right next to you, so just turn your head. Okay, there you go. I'm thinking I can show you the teeth, the custom teeth we make. Yeah, I was actually just working on some before you came in. I would love to show you what we do. So, we make replacements. I mean, we make veneers and we can do anything you need, but one of the things that we specifically do is make custom teeth. Now, these ones are intended to replace teeth that exist already, but we can also do a decorative cap, decorative crown. If you're not missing a tooth, right? We can just cover a tooth with any design that you would like. So these are the two that I worked on recently. Yeah. So we scan your teeth when we do this, and it's made to fit. Yeah. So these are more just for demonstration purposes because they're not quite to size, but it allows anybody who's interested to feel the tooth. They can feel what it's like. You can even put this in your mouth and just kind of feel what it would be like against your other teeth, like this. So, we have those. This one is blue and pink as well. And we've got, this one is a little bit more appropriately sized. And of course, we also just make white replacements. Yeah. So on your left side, I'm really not seeing a lot on your existing teeth. Can you tell me? So this is, imagine this is your back molar, and this, your tongue is towards me here. Are you feeling pain on any particular side of this tooth? Like the back here? Down here? So like right here? Okay, because when I was scraping here, did you notice any pain? I did a little scraping here. I didn't notice. this, and I did ask, and you said you felt okay. I just want to make sure. Okay, so I'm really thinking it's going to be this area back here. I will be curious to see your results on your X-ray too. Okay. I'm gonna feel around in your mouth if that's okay. So do you mind opening for me? Okay, so I'm just gonna push here. How does that feel? Any pain here? How about here? A little bit, okay, and how about here? Okay, so coming back here, if I push here. Okay, on a scale of 1 to 10, that's a 2. Okay, I'm gonna push again. And that's a 3, okay. So when I'm pushing back there, what I'm feeling is a shard. I think what's going on is you had your wisdom teeth removed, but a small shard didn't make it out. Now that's nothing to worry about. We can get it out here. Do you feel comfortable with that? Here are your options. We can do a local anesthetic, so I can numb this area here. We can extract the shard. You're probably gonna be sore for a few days, but you'll be done with the toothache after that. Does it feel like something that's worth doing today, or do you want to think about it? Okay. It sounds like it's really hurting, so that would be my recommendation too, would be to get it out today, because this is no biggie. It's a no biggie procedure, but the pain is real. Yeah, of course. So we're going to polish your teeth, floss, and then we'll do the extraction. Does that sound okay? Alright. Now we have bubblegum polish today. I hope you like bubblegum. And we also have mint. Do you have a preference? The bubblegum, that's what I thought. It's pretty good. Okay. You ready? Okay. That's your top row. All done. Here's a little cup of water for you. You can rinse and then spit in the sink. Okay, I'm going to do your bottom teeth now. You ready? Okay. That's all there is to that. And a little cup of water for you here. Okay. Do you need another one? Of course. There you go. And all that polish really does is takes the top film of protein off your teeth. It's not really doing a ton for us, but it helps us get a better look at your teeth, and it feels really nice. Yeah. That's really it. Are you ready for floss? Don't forget, you can always cover your ears. Okay. Going in. Okay. And the bottoms here. You got some really snug teeth back here. reaching pretty far back here. Last one. Okay, that's it. Done. No more of that. Let's give you a little rinse, okay? And you had very minimal bleeding, which is good. It's what we like to see. So, but even if there was blood, more blood, it's no problem. We figure it out, okay? How are you doing? Okay. So the next part's gonna be the extraction. Are you feeling ready for that? A little nervous about the needle? Okay. Well, I'm ready whenever you are. Now or never yet, okay? I like your attitude. Okay. So, what are you doing after this? You doing anything? Don't look at this. You don't need to look at this. You tell me what you're doing after this. Okay. Are you going with anybody? It sounds pretty fun. Okay. What do you see on that wall? You don't even have to tell me right now. You just tell me. You just think. Think what you see. What do you see? Dog? Yep, that's right. Little dog back there. It's all done. All done. I'm sorry I did that. I'm sorry I had to distract you. I hate doing it. I hope it helped a little. Okay. So, that's just a local anesthetic, so you'll be able to eat and everything, but tell me if you feel this. Okay. And now? Okay. I think we're good. I'm gonna just take a peek here. Okay. Now, I just wanna... Okay. Where did I set those? Oh, they're over here. You stay put there. I see you. I'm so close. Almost here. Oh, don't want those falling out. There we go. Okay. Big scary hook, don't worry. Not gonna poke you. And there's nothing to feel anyway. Okay. Okay, maybe I'll get it this time here. You feeling okay? Okay. Almost there. I can definitely see the shard. We're just trying to get it out now, as gently as we can. Okay, here we go. There's your shard. Pretty big shard. No wonder you were feeling in pain. Steaming up. Okay. That's it. I'm just gonna have you bite down on that gently. That's just there almost done. Feels better already. I'm so glad to hear that. So glad to hear that. Let me just peek in here. Yeah. So you're gonna be a little sore probably for a couple of days. Over-the-counter medicine will take care of that, and I think we're ready to send you on your way. You shouldn't have you have minimal bleeding. You should really be fine with that cause. If you have more issues, give the office a call, and I will answer. I will help you, okay? I'll write your notes up. Do you want to do a follow-up in 6 months? No pressure. Absolutely no pressure. But your insurance covers it, and it's been a pleasure for me to see you. I'd love to see you back, but it's up to you. Sure. Let's put you in, okay? So when you visit the front desk, just let them know. For 6 months, I sent her a message, but just in case. So I'm gonna get your little goodie bag, okay? Okay. Get your floss, and then I have a few colors to choose from for your toothbrush. Yeah, they always make good guest toothbrushes. Yeah. Do you have a preference? The blue one? Okay. And don't let me forget. Okay. Just rinse this off. Is it okay if I put it in your bag? Okay. Perfect. That's for you. Let's get this bib off of you. That's all. Yeah, you're done. It has been a pleasure. Yeah, your teeth are in really good shape. I've got no notes. Just keep doing what you're doing. Keep trying to floss as often as you can. And let us know if you're in pain. But we're here for you. Okay? So, yeah, it's been great. You have a great evening. Have fun. Yeah. Okay, good night. I'll see you.